Here we are again. We're answering questions that I get from the website. I'm with Barbara, and you're going to take me through. I believe we're just going to have one question today because it's going to be quite a long answer or something that's very common that I see a lot of, and we're going to discuss that in more detail.
Okay, our question today is Chantal just turned 60 and feels she looks sad, tired, and saggy. What treatments do you recommend? I don't want to have a facelift. I'm not ready for a facelift.
So I see a lot of patients around that age group, the late 50s and 60s, who've not really had any treatment at all. And they're sad, they're tired, they're saggy, typically. Now, this is where a consultation in detail is very important, because I think we need to match expectations, what I think and what she thinks. So one of the first things we're going to do is to ask her what her concerns are. And we're going to walk through those, and I can address those issues. Usually I get asked, what do you think? And then I will be going through that as well. And I tend to go through it systematically. We look at the face in a very comprehensive, holistic manner. Really, I tend to sort of work from top to bottom and in portions and thirds and all this kind of stuff. But typically, one of the first things we'll start is talking about the use of Botox in these patients, because usually these patients have got brow ptosis. This is coming down. It's one of the easiest and simplest things, and one of the easiest ways for them to start the process of treatment, so that they gain the confidence of the practitioner before throwing themselves into the more complicated procedures. So we're using Botox in this area to give elevation, brow lift. It makes you look less angry, and it makes you look less sad. It's the treatment that I tend to keep to my patients as we get older, is this number one. I don't tend to use much forehead treatment. And again, as we get older, the skin around the eyes becomes very crepey, and there are other things going on there that really where Botox is not quite as good. It still be used, but it's not quite as effective. You have other changes with loss of skin elasticity, and we must remember that Botox works on the muscles to prevent contractions and prevent the wrinkle formation and the furrows. So if we're targeting the muscles, that's fine. But if there are other changes that we have as we get older, particularly as we get into our 60s, then Botox is not necessarily the solution. There's also a fallacy that people think more wrinkles, more Botox. Actually, we get older, we need less Botox, because in fact the muscles have become weaker and there are other changes occurring. As we start to age, we start to lose volume from the temporal area. So we tend to get a lateral aspect. We get the brow dropping here. One of the first changes that we get as we get older actually is the nasolabial fold. We've got the cheek here where the fat is devolumized, and the ligaments and the muscles holding this cheek up become weaker, and we get this descent. And typically we get a nasolabial fold that then forms. We also get changes around in front of the ear, where we lose volume here. We get laxity of the skin. We lack support at the angle of the jaw. We lack support at the chin, or the chin may go back, and typically then we'll develop a jowl. And if we've got a lot of tissue as well in a heavier face, then we're also going to get more jowl formation as this falls down. So there's a lot of things there to talk about, and there's a lot of things there you can address. And I always think it's good to start with some very simple stuff so that the patient can see what you're doing and feel confident. So typically the first thing that we would do that tends to give you more impact initially is to look at using small amounts of fillers along this cheekbone here to give lift, because that's going to resolve some of that nasolabial fold, and it's going to revolumize this area where we've lost volume. The other thing, these days now, we're very fortunate to have a new product called Harmony. And where we have skin laxity, we've lost volume here, and we get a lot of skin laxity around this area too. We can use this product for skin laxity. So it's a collagen stimulator, so we're going to restore some of that fat in a very superficial fat layer. And that's going to help with the jowls in a little bit. Subsequent treatments, we're going to look to volumize the temple area. Now, if you treat this area just on its own, and I've seen this, if you treat this area thinking, well, that's great, we're just going to give more and more lift, what happens is what I call a chicken wing. You get a very prominent arch. You've got no volume here, no volume here, and you have this sort of like a chicken wing. And so you have to make sure that what the treatments that you're doing, you're balancing. So as we are starting to lift and volumize this area here, we've got to start thinking about these areas here as well and treating these so that they have volume there as well. Typically, when we're looking at patients, we in the female particularly, we have this sort of 30-degree curve and light reflection moving across the face at various angles. And so when we lose, as we get older, we're losing volume in certain areas, and we get this concavity, and that's the thing that we need to start addressing. In the male, it's different. We tend to have a squarer face. We don't tend to have so much fat or volume in particular areas, and so there's a different approach for the man. Treatments will include things like jaw contouring, chin projection, anchoring, as I said, temporal volumization, mid-face lift volumization. And then, towards the end, we may be looking at refinement techniques, perhaps with tear trough, perhaps with, obviously perioral, fine lines and wrinkles. And of course, then we're looking at the lips as well. They may need a small amount of filler. I think the danger again is that, people see thin lips and they think, oh, they need volume. Well, unfortunately, that's not the answer, because there are other changes where the proportions change, the balance changes. So in fact, you're going to use very small amounts of fillers. Otherwise, you'll get that duck-like appearance, because typically this length here is lengthened, and putting filler in there is not necessarily the right solution or answer. So I think it's a planned treatment. It's something you would discuss with the patient. You would say these are a number of steps that we should take. Typically, you're going to space those treatments apart. They may be 3 to 5 sessions, I find, and you may be using multiple syringes at each session. I think go slow, go low, go slow, build and wait and have patience. I had a patient this week who said, I'd rather get to the end goal, and I'm very patient about getting there. And I think that's the right attitude to have, not to be in a hurry, because once you get to that desired outcome, if it takes a bit longer, then you've got the right result. And, I think, again, looking to find that right practitioner, having a lot of discussion, a lot of cooling off period, and a lot of thinking about what you're doing and understanding what's involved, both in the treatment, downtime, and also the cost. And I think, these are some of the very important considerations for a patient, especially as you're getting into the 50s and the 60s. If you've never had a treatment before, that you've got to start considering. So,
well, thank you. That was very good. That's our only question.
We only have one question because it was a long one, and there's more that one could talk about. But in a nutshell, that's really kind of way to look and approach those patients.
So have a good consultation.
Yeah.
Do your research for a good doctor, and take your time. You don't have to do everything all at once.
No, don't be in a hurry to get to the end. Be the tortoise, not the hare. That's all we have today.
Right.
And so, if you have any more questions, please go to my website and submit them through that. Thank you.